The thing about heart attacks and accidents is that they strike quickly. One day you're healthy, the next day you are on a ventilator. Most people recoil at the thought of spending weeks, months, or even years in a vegetative state, yet few take time to put treatment instructions and preferences down on paper. This video is about who can establish a patient decree. Does a physician has to comply with a living will? My name is Tamara Freiner. I am an independent attorney at law in the canton of Zurich, Switzerland. If this video appeals to you, please like and share it. Which medical treatment do you consent to and which do you decline? Or who should decide for you in the event of your incapacity? Record this in a living will. Relieve your next of kin. Spare your family the agony of having to think about what you would like to have wanted. They will have to live with their decision. You object that you're healthy and have no pre-existing condition. What if one day you can no longer actively participate in medical decisions? If you have an accident and unable to express yourself, are you in a coma? Forward-looking treatment planning affects everyone. A living will, also called an advanced medical directive or advanced healthcare directive, provides written instructions pertaining to your medical care. It states your preferences. It can identify preferred medical personnel and preferred places of treatment. It may include a do not resuscitate order or that instructions may be prepared separately. There is often a wish not to suffer and to die at home. Express your wishes, values, fears, and hopes in dealing with illness, aging, and death. How do you feel about intensive care? Should all treatment options be exhausted? What does quality of life mean to you? Depending on the illness, the common symptoms and complications are known. You may name preferred medical personnel and preferred places of treatment. Where do you want to be cared for in the phases or in the last phases of your life? Should respiratory distress treated or alleviated? How do you feel about artificial nutrition? A living will may include a do not resuscitate order, DNR. It instructs medical personnel to cease performing life-sustaining treatments such as cardiopulmonary resuscitation, intubation, and defibrillation. Clients use them if they want to stay off life support in the event of a coma or other serious injury or illness. In this way, you may prevent machine from sustaining life without any prospect of improvement. So who draws up a living will and how? How do you do that in Switzerland? Any person having capacity consent may stipulate in a patient decree which medical treatment he or she consents to or not. This advanced healthcare directive must be in writing, dated, signed. You may consider also using forms. A living will may be revoked in writing at any time or amended with a date and signature. The living will is decisive as soon as a person is incapable of judgment. So the question is, does the medical team have to comply with the dispositions contained in the living will? Generally, yes, except where there is reasonable doubt that the dispositions correspond to presumed volition and in urgent cases. In this event, the physician performs such medical treatment according to a presumed volition in the interests of the patient. If the doctor does not comply with the advance directive, he must record the reasons in the patient's medical file. And remember, a living will only is implemented if it's known and if it's found. You may have the place where your patient degree is deposited, recorded on your medical insurance card. Does your representative have access to the original? Have you given copies to your relatives and, if necessary, your family doctor? Please make a note of how you, your partner, and your children wish to be treated, whether all treatment options should be exhausted, and who should decide. Have you established your living will and medical power of attorney? You should. It will assure you and your family peace of mind later. Do you need information? Please contact me. And in order to be informed about various topics, please follow me on social media. Thank you.